Hi there, I'm Doug and I am the developer of Emotional Attachment Behavioral Therapy. In today's video, we're going to discuss the second of the primary objectives of EABT, but first, let's review a few things. Emotional Attachment Behavioral Therapy is a therapeutic model based on attachment theory, which emphasizes how our attachment styles interact with our unhealthy behaviors and tendencies. British psychologist John Bowlby was the first attachment theorist, and he described attachment as a lasting psychological connectedness between human beings. Attachment styles are broadly categorized as being either secure or insecure, and the last decades have seen a substantial growth in studies connecting insecure attachment styles and behavioral health problems. EABT has shown promising initial results in regard to different statistical measures of treatment success, including engagement, retention, completion of treatment, and transitioning to the next level of care. In the last video, we went over the first primary objective of EABT in more detail, which is understanding their attachment styles and their personal attachment characteristics. In order to accomplish this objective, we first educate each participant on the 4 attachment styles. After determining that the client understands the 4 attachment styles, the next thing is to have them take the attachment style quiz. The results of the quiz will rank their attachment styles from strongest to weakest, as well as give them some of their most prominent insecure attachment style characteristics. Next, the participants give personal examples for each of their most prominent characteristics. This allows them to start applying what they are learning to their everyday life. The first objective of emotional attachment behavioral therapy is the foundation for all of the other work the participants will do with this model. Understanding attachment styles and characteristics is the beginning of what will be a life-changing process. In today's video, we're going to dive deeper into the second of the primary objectives of EABT, which is identifying their core attachment stressors and where they stem from in life. In order to understand this, you have to begin with knowing what childhood environmental factors contribute to the development of certain attachment styles. For example, with secure attachment, you can quite often see childhood environmental factors like the child feeling safe and protected by their caregivers, or feeling seen and positively responded to by their caregivers, or the child feeling comforted when distressed. Anxious attachment style can quite often be connected to childhood environmental factors like receiving inconsistent parenting patterns, or not being responded to consistently when needing something, or feeling responsible for caregivers' emotions. Childhood environmental factors that can contribute to an avoidant attachment style are having a caregiver that was overly strict, or having a caregiver that did not tolerate expressing feelings, or the caregiver expecting the child to be overly independent. And lastly, with fearful attachment style, you can quite often see childhood environmental factors like the child suffering from abuse, or the child suffering from childhood trauma, or the caregiver showing highly contrasting behaviors. In order to understand the childhood environmental factors that most impacted them, the participants take our childhood attachment quiz. This assessment is structured similarly to the attachment style quiz. However, after completing this quiz, they will know what experiences from their childhood are most connected to their core attachment stressors. In this example, you see the top 10 insecure attachment experiences from the childhood quiz. Number 1, I received inconsistent parenting patterns. Number 2, I felt responsible for my caregiver's emotions. Number 3, I felt responsible to make my caregiver feel loved. Number 4, I felt responsible to make my caregiver look like the perfect parent. 5, I was separated from my caregiver at an early age. Number 6, I suffered from abuse. Number 7, I suffered from childhood trauma. Number 8, my caregiver was a source of fear. Number 9, my caregiver was extremely inconsistent. And number 10, I could not trust my caregiver. After identifying childhood experiences that most impacted them, the next task is to identify unmet needs that correlate to those experiences. To accomplish this, we have the participants identify the biggest unmet needs that connect to each of their top 5 childhood experiences. Core attachment stressors are comprised of unmet needs that stem from our previous experiences in life. In this example, you see that the childhood experience identified is that my caregiver was extremely inconsistent. The 3 unmet needs that were connected to that experience were stability, trust, and safety. The second objective of emotional attachment behavioral therapy is how we quickly and safely get to the root of the problems. Identifying core attachment stressors and where they stem from in life will help inform a great deal of the work we will do moving forward. One thing that makes EABT so unique is the dual-prong approach of not only working on your current areas of need, but the core areas that initiated the problems in the first place. For individuals that have developed insecure attachment styles, EABT can help. We can begin to work with you on your attachment patterns while also increasing the levels of secure attachment in your life. To learn more about EABT, follow this link to our website where you can begin your journey with our attachment style quiz. Thank you so much for joining us today. In the next video, we're going to cover the third of the primary objectives of EABT, which is learning their physical, emotional, and mental symptoms of trigger activation for early onset intervention. If you enjoyed this video, please give it a thumbs up. And if you want to show us your support, please subscribe to our channel and ring that notification bell so you can be notified of all the latest videos that are coming out. Thanks again for joining us today. Take care.